Hello, this is Gene Rossov. I'm president of Iodine Products. We're going to have a brief discussion today of the systemic absorption of the PVP-Iodine in our product, liquid mask, via the oral and nasal route. Liquid mask is an oral nasal spray, and it's readily available throughout the world, and especially here in the United States. So this is therefore a brief medico-biological review of liquid mask, a oral nasal antimicrobial spray, which has a variety of systemic enhancement abilities. It's a very interesting product, and it's very interesting how the body deals with it, as you'll see. So our overview is to evaluate the systemic absorption of this product and the destination of iodine from the 1% PVPI liquid mask spray. We're going to discuss the oral cavity, the nasal mucosa, the sinuses, the central nervous system, and we'll refer in general to supportive studies relative to our unique oral nasal spray liquid mask. Should you want to see the product or purchase the product, go to liquidmask.org, and you might want to keep in mind that it's been used by over 20,000 medical professionals and by their patients with extraordinary success. The oral cavity is highly vascularized. The vascularization occurs in both the sublingual and the buccal regions, that is, beneath the tongue and around the tongue, and the cheeks, buccal regions. And there is rapid conversion of iodine in our product to iodide by salivary enzymes. So this conversion occurs quite rapidly, and the resulting, in a matter of seconds, the resulting iodide is absorbed, distributed, and stored in the salivary glands, the thyroid, and the circulatory system, and also a little bit in the central nervous system via the central nervous system spinal fluid. We should point out that the salivary glands, we commonly think of them as there being three of them, three sets of them. And there are sublingual and a couple of others on the sides of your neck and underneath your jaw. But in addition to these three major sets of salivary glands, there are some 10,000 microscopic salivary glands that populate the oral mucosa. So there's a tremendous amount of opportunity for uptake in the mouth. And there is substantial iodide uptake systemically using our liquid mask product. The very thin but extremely vascularized oral mucosa supports drug delivery. Iodide enters the blood itself via the facial vein, and there is in addition modest central nervous system access via the olfactory mucosa when you spray this product into your nose. And despite its modest amount of application, iodine does reach the central nervous system, and it shows demonstrable entry via CNS fluids. So while there is mostly systemic absorption via the mouth and its various systems, there is also absorption into the brain and the general central nervous system. And that's important. There is some sinus penetration, not a great deal. The sinuses are lined with respiratory epithelium, and our standard oral nasal spray provides limited penetration. The best way to reach the sinuses is by irrigation, and specifically sinus delivery devices. And although sinus access is limited, there is a little bit of it. And liquid mask can help in the case of some sinus infections if it is used routinely and used with greater frequency. Relative to the brain, central nervous system uptake, the olfactory mucosa offer limited CNS access. However, if we test for an increase of iodide in the central nervous system fluid following application, it indeed shows that there is absorption. And part of the delivery systems for insulin and oxytocin and iodine generally via the intranasal route is quite rapid and quite effective. Central nervous system entry of iodine is likely, limited though, and while it's useful, it is not the best route, although it's a contributory and perhaps in some cases a significant and important route. There are hundreds of published studies in reputable journals about the efficacy of PVP-I 1% as an antiviral agent. And liquid mask, which has been used extensively throughout the medical community and the general public, shows a greater than 90% viral reduction instantly. And by instantly, I mean within seconds of use. So not only is it absorbed and it protects against viral infections immediately, but it also kills resident viral particles immediately upon application. So one has to wonder why it wasn't used during our last pandemic. It was advised to be used in 1945 by Nobel laureate F. McFarlane Burnett, who found that a 1% solution of iodine in air was extremely effective at disposing of all influenza viruses. So one has to wonder. When you take our product systemically through the mouth and the nose, the plasma fraction of iodide is easy to measure, and it rises significantly after topical use because of the nature of its absorption and its long evolutionary history and usefulness. We've done many topical iodine absorption studies. We know that PVP-I, particularly a 1% low concentration solution, creates measurable increase of iodide in the blood. We know that it enhances intake via the mucosal apparatus, and there have been numerous studies that show this. It is absolutely accepted scientific principle. It's an interesting thing to consider whether via the nose you are going to get iodine into the brain. And of course, we can systemically deliver things like insulin and neuropeptides by the nasal route. There's a fair amount of experimentation of vaccination using the nose as a delivery mechanism. And via olfactory neurons and paracellular diffusion, we do get iodine into the central nervous system. So to be a bit extreme about it, could we say that oral nasal iodine might make us smarter and help our brain to develop? And it, to some extent, it wouldn't be completely science fiction to say that it could contribute to that. And of course, it contributes marginally to daily required iodine intake for general health. So, absorption summary. The absorption in the oral mucosa is very high via salivary uptake. The nasal mucosa have a moderate to high uptake of iodine as iodide. The buccal membranes, the cheek membranes, all of the sodium iodide symporter structures lining those membranes provide a moderate to high intake of iodine. The sinuses, rather a minimal intake, so you're not going to use this product for a sinus infection, although it will help. And it will help the transfer of infectious disease. It will help to subtend the transfer of infectious disease organisms into the sinuses via the nose, which is a common route of entry, of course. And there will be some appearance of iodide in the central nervous system via the olfactory apparatus. Folks have often asked me if using liquid mask will deliver iodine into the lungs. The answer is yes, but to a very modest degree. If you want to deliver or need to deliver, or perhaps should deliver, iodine to the lungs, you would want to use a different product of ours, our passive iodine inhaler. And you can call us and ask about that. So here's what liquid mask looks like. It comes in a cheerful blue and yellow box. The oral nasal spray bottles look like that. We sell them in lots of 2. You can buy 2 of them for $30. There is no shipping charge. So $30 will get you what is typically 2 to 4 months supply of liquid mask. And you can happily use it, especially when traveling, when going to supermarket, whenever you might have exposure to people who may or may not be carrying or transmitting infectious disease organisms, and especially the flu, be it COVID or seasonal flu or respiratory syncytial viruses like the so-called common cold. If you have any questions, you can call us at 305-667-9375. We're available 24/7, and we look forward to hearing from you at absolutely any time.